Congressman Issa is here, along with Democratic Congressman Scott Peters. Gentlemen, first, good morning.
Good morning.
Thank you for being here. And let me set the table for everybody here at home. This is not going to be a debate. We're not going to try to get you to fight each other. I just want you to, we want to have a conversation and more or less a search for some solutions here. So we'll talk solutions in a second. But first, Congressman Peters, what do you see as the major problems right now with Obamacare?
Well, the immediate problem is there's a lot of uncertainty in the markets. So I wasn't around when Obamacare was passed. I think we should not be surprised or embarrassed that it needs adjustments. And one of the issues is in some states there's nobody covering individual markets. In our state we see our rate in the county has gone down from 17% uninsured to 5% uninsured. We still have to worry about premiums. And I think we have to provide some certainty to insurers and to providers about what's going on so that they can keep those premiums down.
Same question, Congressman Issa.
Well, I was there when the Affordable Care Act was passed, and the real problem was it didn't have enough choice. It was a bold idea, but it didn't address cost drivers. And I think for all of us on a bipartisan basis, no matter what we have to do to prop up the Affordable Care Act, what we really have to do is, for the first time in a generation, is address the cost drivers. What is causing health care costs to go up? We fix that, we will fix part of the problem of that 12% increase.
I could speak to that. I mean, as a dad, I have 3 kids under the age of 5, and the cost. I mean, we go to the hospital, go to ER, go to urgent care. Who knows? I don't know how much I'm paying for stuff. I just say, oh, I have insurance, I have a copay, maybe something like that. I don't know. You get this bill. I can't read the bill. There are people who study and have degrees in medical billing and coding because it's so complicated, right? Why not make that easier? That's a good point. Let's talk solutions, too, as well. Congressman Peters and Congressman Issa, we'll go one step further there. What do you think?
Sure, I agree. I would just say immediately, let's see if we can stabilize the market. So I'm part of a group called the Problem Solvers Caucus that's come up with some ideas to reduce uncertainty. Namely, there's cost-sharing subsidies that the government pays to keep prices down for people who can't afford it. There's a reinsurance idea that for really high-cost cases, you would provide some backstop for insurance companies so they don't have to raise everybody's premiums to cover that. Let's do some of those things that we can agree on to stabilize the markets, get premiums down, and there's a whole another conversation about what we have to do to lower costs in general.
Cost drivers, Congressman.
Cost drivers.
Just a little bit more. I know you.
Well, in Europe, drugs are typically approved 2 to 3 years, and medical devices ahead of the United States. FDA is too slow and too bureaucratic, and it drives up cost for our bio and pharma industry by billions of dollars often per drug. Defensive medicine. There's no question at all we want doctors to make decisions based on the, if you will, the 99% rule, not a 1% rule where they order an extra MRI or an extra procedure because they don't want to take a chance that
they'll be sued.
They'll be sued.
Right.
We've got to change the culture from what's best for the patient rather than what's safest for the hospital.
Okay. Obamacare passed with the Democrats under President Obama in the House and Senate, and there was little to no Republican support. The attempt to replace Obamacare under now the current Republican administration happening with little to no Democrat support. Now, and this morning, maybe you're reading and hearing, there's a more bipartisan effort for Republicans and Democrats to come together and try to fix it. Why wasn't this part of the conversation in the beginning when Democrats had the power and now Republicans have the power? Who wants to take a stab at that?
Well, I guess I was there.
Yeah.
Compromise is not a dirty word, but it sounds like it's.
Well, what you're both saying so far sounds, I think, sensible. Would you agree, people at home? Sensible?
Our challenge is.
I haven't heard anything that was like, that's outrageous. Right.
If your only compromise is within your own party, you're going to get a one-party solution. If you compromise across the aisle, you often get less, but you get something people believe in. People believe Medicare is a good idea, and they believe they pay into it, and if it needs to be fixed, there'll be bipartisan support to fix it. But when you have something that's done by one party, the problem is one party owns it. Currently, the Democratic Party still owns the Affordable Care Act, and that's got to change. We've got to get to where health care is owned by both sides again, and that is going to take coming together. It's going to take probably getting rid of some things that are in the Affordable Care Act that Republicans object to, keeping some things. The good news is we've both managed to realize that the system needs attention, and that attention's only going to happen if both parties agree.
You agree? I'll just say, well, I sort of agree. I don't think that Democrats own this anymore. I mean, this whole Republican effort to go through repeal and replace, which came crashing down, was something done without Democratic support. We were interested in working on it. That's really our goal. And these premiums are about to go up because we haven't accomplished anything in the last 6 months. But I would say that
premiums have been going up before the last 6 months, right?
No, but I would just
they went up 13% last year for people in California on Obamacare. So they've been going up.
Slowed quite a bit.
Triple digits.
Slowed quite a bit from before. But I'm saying that that's on us to work on now. And so now that we're through this one-party attempt to repeal and replace, let's get to work and really work together.
I would like each of you quickly to address your constituents. Congressman Issa, to people on the other side who have been protesting even at your office, saying health care is a right, not a privilege. They don't want you to take it away. It literally could cost their lives, and they feel it's a moral responsibility to provide health care. And Congressman Peters, to you as well, to other people who say the government shouldn't be involved in health care to this degree. It's 1/5, 1/6 of the economy, and people that don't want to pay for something that they feel like, or services that they don't want. Real quickly, we only have about 30 seconds left. Can you do that?
Look, you have a right, but there's a limit to how much you can take from people to provide that right. And there has to be a certain amount of ownership by the public in health care.
Congressman Peters.
And I'm going to Washington to work with anyone, a Republican or Democrat, who can help provide access and keep premiums down. That's what we all want.
Okay. So guess what? Thank you so much, gentlemen, by the way. And we're not going to let you go just yet because we're going to come back at 8:30. And we're going to have both of you, we're going to take the conversation even a little bit further, maybe expand it to a macro. I asked some of you on Facebook questions for the congressman, and got some really good ones, too. And you're going to hear those coming up again at 8:30. Right now, we're going to step away, take a quick break, and we will be right back after this.